If you or someone else you love has high blood pressure, then there is a chance that you may have come across or heard of the name amlodipine. It's one of the most common prescribed medication in the world. Yet I see patients every day who aren't sure exactly what the medication is or why their ankles are swollen. And today on the Medication Navigator, we're breaking down everything you need to know about amlodipine, how it works, what are the common side effects, and the one thing you should never do while you're taking this medication. Amlodipine belongs to a class of drugs called the calcium channel blockers. And no, it doesn't block the calcium from entering your bones. It only blocks the calcium from entering the muscle cells of your heart. Think of your blood vessels like a garden hose. When they are tight and constricted, the pressure goes up. Amlodipine works by preventing the calcium from entering the muscle cells of your heart and your blood vessels. And when this happens, this causes your blood vessels to relax or widen. And when the vessels relax, your blood flows more easily and your heart doesn't have to work nearly as hard. Now, most people tolerate amlodipine very, very well, but there is one side effect I get asked about more than any other, and it's the peripheral edema, also known as swelling of the ankles or feet. This happens because amlodipine relaxes and opens up the blood vessels so well, sometimes it causes fluid to leak into surrounding tissues, and gravity pulls it down to pull in your ankles or feet. So if you ever notice your socks leaving deep imprints or your shoes feeling tight by 5 p.m., that's likely the amlodipine. Other common side effects include dizziness, and this usually happens when you first start taking the medication or there has been an increase to your dose. Sometimes while you're on it, you can experience flushing, which is a warm sensation in your neck or face, and palpitations, that feeling like your heart is really racing. Here's a pro tip. If you notice any swelling, don't just stop taking the medication. Talk to your doctor. Sometimes a simple dose adjustment or adding on a second medication can fix it. Now, this is where we need to be extra careful. A lot of people think that just because it's a supplement, it's natural and it won't interfere with their prescription medications. But as your medication navigator, I have to tell you, that's not always true. Amlodipine is processed by a specific enzyme in your liver, and several common herbs or supplements can either speed up or clog that process. Here are the big 6 you need to watch out for. Grapefruit, and this is a famous one. Grapefruit clogs the enzyme that processes amlodipine. This means that the drug can stay in your system longer, which can lead to dangerously low blood pressures or severe ankle swelling. Number 2, St. John's wort. This actually does the opposite and speeds up the enzyme that processes amlodipine, causing your body to get rid of it quickly. And if it's gone too quickly, it's not going to control your blood pressure. Number 3, Yohimbine. Often found in performance or weight loss supplements, Yohimbine can actually raise your blood pressure, which will essentially fight against the amlodipine and making the medication less effective. Number 4 and 5, Ginkgo biloba and Echinacea. Both of these can affect how your liver processes amlodipine. While more research is being done, we know that both of these can potentially increase the levels of the drug in your body, making side effects more likely. And last on the list is ginseng. While ginseng has many uses, it can occasionally cause your blood pressure to spike or interfere with how your blood pressure medication works. If you're a regular ginseng user, you need to closely monitor your blood pressure readings. But the bottom line is you should always tell your pharmacist what herbal supplements you are currently on. We're here to make sure that your supplement routine does not sabotage your heart health. As your medication navigator, here are 3 things you need to remember. 1, consistency is key. It doesn't matter when you take your amlodipine. What matters the most is that you consistently take it the same time every day. 2, stand up slowly. Since this drug lowers your blood pressure, standing up fast can make you lightheaded and dizzy. So take your time getting out of bed or getting off the chair. And 3, make sure you always consult your pharmacist and or your doctor about the supplements that you are taking. Remember, amlodipine is a powerful tool in preventing strokes and controlling your blood pressure, but it works best when you're informed. If you found this breakdown helpful, hit that subscribe button and join us here at the Medication Navigator. We're here to help you steer clear of the complexities of your medication cabinet. Leave a comment below. Have you experienced amlodipine ankle swelling? Or were you ever worried about these interactions? Let's talk about it. Until next time, stay healthy.